Trauma-informed care. What does it mean? How does it impact the people you serve? This course was created to help you understand how trauma impacts individuals and organizations. When we use a trauma-informed lens, we can improve outcomes and create thriving work environments.
Have you heard of laughter yoga?
Yes.
You practice laughing even if you're not feeling it, where it's fake at first.
That is correct.
It changes your brain.
Did you know that there are typical psychological phases of disasters? During traumatic times, it's hard for our brain to function normally. So the cognitive reactions that people may have include things like disorientation, confusion, and trouble concentrating.
The body actually perceives the stress as a threat. So what do we do when we're threatened? We got to get ready to either fight it or run away.
In order to provide optimal help to those you serve, you need a solid understanding of what trauma-informed care is and a firm grasp of the ins and outs of navigating this approach.
The topic of trauma has been around for decades. Trauma is more common than people realize. Over half of the adult population experience at least one traumatic incident in their lifetime. Trauma science has been exploding over the last 20 years. We're learning so much about the brain, the body, the human stress response system, and how memory and focus are impacted by traumatic stress. So trauma isn't new. But there's a new approach to understanding how trauma influences all of us and how we live and work each day. Trauma-informed care includes two things: services and approach.
Now that we have thoroughly covered history taking, we can walk through the physical examination portion of the SAFE exam. It is essential to a successful exam that evidence is handled carefully, so let's begin reviewing some evidence collection basics. To prevent contamination of any samples, preserve each specimen separately. Use and change gloves often. Avoid coughing or sneezing during evidence collection, and be careful to use the appropriate tools. When discussing evidence collection, we start with Locard's exchange principle, which holds that when any person comes into contact with an object or another person, cross-transfer of physical evidence occurs. Therefore, physical evidence is to be expected at a crime scene. Simply put, this principle helps investigators find and analyze physical evidence left behind. Unfortunately, physical evidence from sexual assault cases is more likely to be lost because the people involved are usually alive and moving. Evidence can be successfully collected up to 19 days after an assault, although the time that DNA lasts varies according to where it is found.
My name is Dr. Amanda Helmer. I am an assistant professor at St. Louis University in addiction medicine. I'm an internal medicine doctor by training, and I've been practicing for 25 years. So let's talk a little bit about what the causes are of addiction. And so some of that is actually very similar to other chronic relapsing conditions. The first primary player would be genetics, and the genetic component of addiction is about 40 to 60%, which has very similar numbers to diabetes, to high blood pressure, to asthma. This is the obligatory graph of the overdose crisis over the last 2 decades. And we like to think of it as 4 different phases of overdoses. And so initially in the late 1990s, early 2000s, these overdose deaths were related to prescribing patterns. Doctors had changed their prescribing practices with opioid pain pills, and It was recognized that pain was used as the fifth vital sign. Based on flawed data, we felt that people who had chronic pain had a low risk of becoming addicted to opioid pain medication if it was just used for pain.